Up when we're live, Kathy. Oh, okay, there we are. All right, here we go. We're back at it. Another Canadians for Long-Term Care Town Hall session. Thank you, everybody, for joining us today. My name is Melissa Miller. I'm one of the co-founders of Canadians for Long-Term Care, and I'm also an elder law and nursing home negligence litigator. Happy to represent hundreds of families who are trying to get some accountability as a result of negligence in long-term care homes across the country. And I'm here with Kathy Parks, who is a family advocate and one of my clients, and Dr. Vivian Stamatopoulos, also one of my clients and one of our leading advocates and experts in long-term care on these issues in Canada. Today, we have members of the Green Party, which I'm very excited about. We have Annamie Paul, who is the leader of the federal Green Party, Mike Schreiner, the leader of the provincial Green Party, and Jenica Atwin, who is a Green Party MP from New Brunswick. So thank you, all three of you guys, for coming today. We really appreciate your time. We, of course, are here to talk about national standards for long-term care. I think it goes without saying, certainly for the six of us who are in this meeting right now, we know that these are necessary and a long time coming. So I'm really excited to have you guys here and hear what you have to say. I'm going to turn the floor over to each of you, starting with Annamie, to talk about, you know, what your experience has been and just give us a little bit of an introduction about where you're coming from in terms of your either platform, party position, or where you see the need. And then we'll dive into some questions and some open discussion for our viewers. So Annamie, thank you for joining us. I will turn the floor over to you.
Thank you very much for having me. And just first to acknowledge that I'm here in Toronto on the traditional territories of the Mississauga of the Credit, the Anishinaabe, the Haudenosaunee, and the Huron-Wendat, which I say with a great deal of gratitude. And, you know, before we even get started, I just wanted to say a tremendous thank you to all of you for your advocacy and your leadership. I say that as someone who I hope at this point is an advocate themselves, but also as someone who, you know, wears a multiplicity of hats. On the one hand, I am a person whose father lived in long-term care and died in long-term care during the pandemic in one of the hardest hit for-profit long-term care homes in the country. I'm also someone who is, you know, I'm a Black woman and from a family of immigrants, which means in Toronto often, and my family is no different, that there are a number of women in my family who have worked or who do work as personal support workers in long-term care homes in Ontario. You know, my grandma, that's what she did for a number of years before going to be a personal support worker in the hospitals. And so I come at this as someone who understands the loss of losing someone unnecessarily in long-term care during this pandemic, and also as someone who understands the kind of difficult, literally back-breaking work that so many low-income, racialized women in particular have to do. And you know, these and other reasons have just caused me to, throughout this pandemic in particular, really push on my behalf, on behalf of our members, on behalf of all of the people who are living this nightmare in Canada, to really push for change in long-term care. This is a question of an original sin that was never rectified, and we've seen the consequences of that play out day in and day out. This is something, you know, we always should have had these national standards. We always should have had these protections in place. And more than anything else, we should always have said as a country that we value life from the beginning to the end, that there is no distinction, and that there isn't a phase of your life or a stage of your life where you no longer matter and where you're not deserving of the same quality of healthcare. And so, we know that we are moving out of the deaths in long-term care exactly because of the advocacy of people like you, Canadians for Long-Term Care, and so many of the families who have been advocating to get those vaccines when they weren't actually going where they needed to be in long-term care. So that is one battle that, you all can feel so proud about, because I don't think it would have happened as quickly without you. Then there's the longer slog, and the thing that we have to start turning our minds to, which is how do we make sure that it never happens again? How do we protect people in long-term care for the rest of this pandemic, because it's not over? How do we ensure that, again, that people can live in dignity from day one until the very last day? And so we have been speaking about, well, just as recently as today, our MP Paul Manley from Nanaimo Ladysmith put forward a motion listing some of the recommendations, some of the key recommendations that had come out of the roundtables, the town halls that we've had with Dr. Vivian and others about long-term care reform. When the Green Party does things, it is evidence informed. We go and seek the advice of the experts, of the people who are closest to the issue, who are most closely impacted. And as much as possible, we see ourselves as a platform for their voices, as opposed to speaking on their behalf. We want people to speak for themselves. And so when we talk about the need for national standards, when we talk about the need to have universal access, to take the profit out of long-term care, to have proper pay and proper sick leave for personal support workers. When we talk about all of those things, it is because there is such a tremendous consensus amongst the long-term care community, whether the families, the advocates, the health experts. There is such a consensus around what needs to be done, even in what order, in terms of the pandemic and heading out of it. And so what we need now is the political will. And I am very encouraged, and I will say this because, listen, we're a different kind of party. And, people ask that question all the time. What are the differences? Here's one. We don't need to take all the credit. We don't need to take all the credit. We don't want to take all the credit. You're not going to hear any of us say today, we are the only ones talking about this. We're the only ones fighting for this. We're never going to say that. I congratulate all of those across party lines who have decided that we are never again going to be where we were and where we are right now. And we want to work with them because this should not be a partisan issue. And if it isn't, just imagine, if it isn't, it means that we can actually, in the lifetime of this parliament, not the next parliament or the one after that, but within the life of this parliament, we can put the money and the work into ensuring that all of those things come to pass exactly because we have that cross-party consensus. And so, as we look to the budget and beyond it, what I hope we'll see is that across party lines, we say that long-term care is an absolute priority. The dignity of every person in Canada is an absolute priority. And we are going to sit down together to make sure that what you have all told us happens and happens as quickly as possible. So thank you very much for the invitation. I certainly could go on, but I'm really looking forward to what all of you have to say as well. I do this in honor of my father, and I do this in honor of all of those who have been lost. Thank you very much.
Thank you so much. And I apologize, I was mispronouncing your name. It's Annamie, right?
That's right.
Okay,
So
okay. I'm so sorry.
Don't worry.
I know, but it doesn't matter. I should say your name properly. Thank you for that. And also my condolences for the loss of your father. I've, Kathy, I know, can certainly relate. Well, so can Vivian. I hear these stories over and over and over again every day, and I know how difficult it was or must have been. So thank you. And I also really appreciate that you said that these issues supersede party politics. We've been saying that for a while. And I know when you said, all we need is the political will, I could see Vivian's ears spark up because she's been saying that, I think, at every opportunity she's been getting. So, the three of us sincerely appreciate those comments. I'm going to turn it over now to Mike Schreiner, leader of our Provincial Green Party, to give yourself a little intro and tell us about what you think about national standards.
Great. Well, thanks, Melissa. I really appreciate that. And it's a real honor to join you and Kathy and Dr. Stamatopoulos, and of course, Annamie and Jenica, my fellow federal Greens. And like Annamie, I'm speaking from my Queen's Park office on the Treaty 13 lands of the Mississaugas of the Credit First Nation, and just want to express my gratitude for so much of what I've learned from Indigenous peoples about just how to care for this place we call home for ourselves and the next 7 generations. And I'm so grateful for the work that Canadians for Long-Term Care has done, is doing. Like, your advocacy is making a huge difference, and we really feel it here at Queen's Park. And so, I think one of the lessons for me from COVID-19 is just how it's exposed the massive gaps in many of our systems, but especially how we care for the most vulnerable, how we care for elders, and how we treat workers. And I should mention that, the tragedy and the humanitarian crisis we're experiencing in long-term care in Ontario really is the result of decades of inaction from multiple governments in this province. They've put us in this position that we're in today, underfunded, understaffed, an LTC system that fails to our elders, workers, fails to provide them with the dignity and respect that they deserve. And just want to acknowledge that, as of today, tragically, we've lost 3,763 residents and 11 staff in long-term care. And those are people. They're grandmothers, grandfathers, mothers, fathers, aunts, uncles, brothers, sisters. And my heart just goes out to everyone who's lost somebody, and especially to you, Annamie. Condolences to you. And, I remember 15 years ago, before I came into politics, I was a part of a nonprofit organization working to get local food into public facilities. And we worked so hard to try to get healthy, local, Ontario-grown fresh fruits and vegetables in particular into long-term care homes in Ontario, and found it virtually impossible because the food budgets are so low that it's just almost impossible to be able to afford healthy food. And I think what breaks my heart about what we've experienced over the last year is that, in that intervening 15 years, things haven't really changed. And I know the current government likes to blame the previous government for everything that we're experiencing. But the bottom line is the current government had 2.5 years to make a difference. But instead, they've dropped the ball on inspections. They've delayed hiring more staff. They've actually, in my opinion, spent more time trying to protect long-term care owners from lawsuits than they have in actually trying to fix the challenges in long-term care. And what for me is especially infuriating is that over the summer, the Ford government was sitting on $12 billion that could have gone into preparing us for the second wave. And all the expert reports tell us that 1.9 billion is what was needed to hire the additional staff and to pay them a living wage. And to think that as of September, the government was sitting on 12 billion, to me, is just an unforgivable lack of caring and compassion for elders and for the workers in our long-term care homes. And so some of the things I'm working on, and I'll get to national standards, but in tomorrow's budget, I'm looking for that $1.9 billion because we need to hire the staff to achieve a minimum standard of care of 4 hours now, not 4 years from now. And the question I asked in question period today was, not only do we need that, but we also need to make sure we provide mental health supports for workers in long-term care homes. The fact that I think it's close to well over 60% of nurses surveyed who work in long-term care are experiencing symptoms of PTSD. just tells you the challenges of what it's like to be run off your feet, working in a place where you as a worker care so deeply about the people you're caring for, but you're understaffed, you're overworked, you're underappreciated. And so we absolutely need to ensure that we have a permanent pay increase, especially for PSWs, that we improve ratios, nurse ratios in our long-term care homes, that we guarantee full-time work for workers with benefits, and that we really get past the rhetoric of talking about heroes on the front lines and actually start treating workers like heroes. Like, it's one thing to say it, it's another thing to actually implement the policies that treat people like heroes. Things like paid sick leave. I mean, the fact that in my writing, a number of workers in long-term care haven't been vaccinated yet, not because they don't want to vaccination, not because one's not available to them, but because they're unable to get a vaccine unless they're given some paid time off to go get a vaccine. The fact that we're not even mandating, one, it's bad enough that the government's not mandating paid sick leave, but to not have paid leave to get a vaccine for some of the lowest paid, most essential and vital workers, to me, is just unconscionable. I just don't even understand how this is continuing to happen after all we've learned over the last year. And so in terms of national standards, I absolutely think we need to have national standards across Canada. And I'm hoping, and I know Annamie and Jenica are certainly advocating for this, that with those national standards come additional federal funding to help provinces with long-term care, because we know it's chronically underfunded. With that is a transition away from for-profit long-term care. I mean, it's absolutely essential that we prioritize care over profits. The fact that more dividends in Ontario went out to shareholders during the first wave of the pandemic than actual money that the province paid to long-term care operators. Like, I don't even understand how that's possible, especially given the tragedy that we were facing. And so I know there's a lot of conversation around like jurisdictional issues and this and that, but the bottom line is the Canada Health Act has national standards. The federal government provides provinces with money, and then the provinces operate the healthcare system in a way that meets those national standards. And I don't see why we can't do the same thing with long-term care. And so I just don't buy some of these jurisdictional disputes and debates and conflict around actually delivering the change we need to properly care for elders and the people who care for our loved ones.
Yeah, no, thanks for that, Mike. I don't know if you may not remember, you and I were on Libby Znaimer's show together a while back. Yeah, and I remember.
I do remember that.
Yeah, I was listening to you and I was like, yes. So it's funny that you mentioned the Canada Health Act and the funding, because I'm actually very excited to announce, sorry, Jenica, I'll get to you in a second. We launched a legal opinion yesterday in conjunction with all of the provincial health coalitions and the Canada Health Coalition, which is basically a draft of what the national standards would look like. And it's exactly what you just described. It is building on the Canada Health Act, so it will be a separate piece of legislation, the way the Canada Health Act is, and using the principles within the Canada Health Act and building upon that, tying federal funding to compliance with these national standards. And one of the principles would be that the funding would need to go to not-for-profit and publicly owned homes as opposed to private homes. And I'm extremely happy to hear that there's this movement towards, there seems to be this consensus growing towards that type of scenario, independent of one another. And so it's really nice to hear you say that. And Annamie, I'm sure you'll have more to say on this later, but I had to put that plug in because you were talking about it. And in my view, I think, as a lawyer, I think that deals with the jurisdiction issue. But Jenica, I'll turn it over to you now. not only are you an MP sitting in our federal parliament, but you have the experience in New Brunswick. So I'm excited to hear what you have to say, and I'll turn the floor over to you.
Sure. Thanks so much, Melissa. And it's just a pleasure to join you all today for such an important conversation. And then we can't reiterate that enough. And I mean, I certainly echo, what my leader Annamie is saying, and Mike as well. And also just to acknowledge that I'm speaking on the unceded territory of the Wolastoq here in beautiful Fredericton, New Brunswick, where I am privileged to learn and to work and live. And I also have a grandmother in long-term care. So this is personal. I think it should be personal for all of us, whether or not you have that connection. It should be, seriously, an awareness piece that we've been missing. And it's just shocking that we even have to push, this conversation, but we're here now, we're here. And so, through my grandmother's experience as an example, she's had to move around because the fit wasn't always there. And we've experienced some of the best that New Brunswick system has to offer, and some of the worst, sadly. And a lot of it, I think, stems from some of our rural, facilities, because there's often this kind of out of sight, out of mind mentality in my province. So there's some of the things we need to address with that as well. And I certainly can't, engage in this conversation without highlighting some of the incredible work of not-for-profits here on the ground, as well as our NB Nurses Union. They released a report in the pandemic from studies largely stemming from 2016 to 2019, and it was aptly named the Forgotten Generation. So here in New Brunswick, we have, the fastest aging population in Canada, although sometimes if we go back and forth with Nova Scotia for that tagline, I guess. But it's clear that our rapidly aging population is not set to receive the quality of care, that they deserve. And I've got many close ties to Indigenous communities. My children are Indigenous. My husband, my stepfather, and that has taught me many lessons, but perhaps the most important lesson is the importance that's placed on values on elders. So that respect that they command, that first in line status for all services and programs. So the rest of Canada really needs to catch up to this model. There's many things we can learn from Indigenous society, but that is certainly one that should resonate with all of us. That it speaks to our humanity. What have we been doing? And we knew these things long before the pandemic, but shockingly, exacerbated just throughout this whole experience. And I'm thankful for, pointing out the emphasis on workers and their rights as well, because that's been a big source of many of the issues. Here in New Brunswick, we certainly fared slightly better throughout the pandemic, but those issues in long-term care were very much there. And the majority of deaths associated with COVID-19 occurred in our long-term care facilities because of workers having to work in multiple facilities to make ends meet. So there's just, again, it's something that's happening across the country. So clearly we need those national standards to ensure that no matter where you are, no matter what jurisdiction, that you're able to count on the services for your loved ones. So just some of the things highlighted from that report, just the growing wait list, for example, just on accessing beds is an issue. And so, since the year 2000, this list has increased by 1,000%. So there's a real fear that we can't even meet, have those beds filled, let alone have the standards of care be met. And there's actually more pressure on government to ease back on safety and regulation to save money and cut corners. And there's a real fear growing that while we have a majority of a not-for-profit system, they're pushing towards a more private system. And that's where so many of these issues really originate. So, I won't take long for my introduction just because so many wonderful things have been said already by Mike and Annamie. And I'm just thankful again for this conversation and for your work. And hopefully this is one of the lessons of COVID that we won't soon forget. And absolutely, partisanship aside, all hands on deck, enough is enough. We need to work together on this one.
Thanks so much, Jenica. That was great. So we've got a couple of questions for you guys. We're going to take turns. Dr. Vivian's going to go first to ask Annamie a question, and then we'll have some open discussion after.
My turn. Hi, Annamie. Annamie knows how much I like her. You spoke at St. George, and that is, of course, where your father passed away, and better than anyone the issues within these homes, and you've lived this, and we really appreciated you really coming out that day and just standing strong and standing tall in what you were saying, and really supporting the families. So we want to thank you for that first and foremost. But then I want to ask, based on your experiences, because I know for a fact my advocacy stems from my personal experiences with long-term care, as does Kathy's. and I imagine yours does as well. Based on both your personal experiences and what you've seen happen here in Ontario, what kinds of, specific things would you like to see, or, that Paul Manley has recently filed in terms of the changes we need? Like, does it involve staffing? Does it involve, more quality inspections? What kinds of things do you hope to see?
Well, if I repeat them again, I'll just sound like a broken record, because I have never, and just my background, I'm a lawyer as well, and I'm a policy analyst, and I rarely do you see such a consensus. We held roundtables, we've held town halls, press conferences, we've held them with advocates and experts from coast to coast during the pandemic. And we've held them in French, we've held them in English, and it is always the same. The list that Mike gave and the points that Jenica mentioned and I mentioned out the top, we know what the things are. We know the difference it would make to have more staff, to have better trained staff, better paid staff, staff with access to sick leave. We know that is just essential for the reasons that we said. We know that minimum of 4 hours of regulated care is something that the consensus is unanimous around that as well. We know that national, this is the one thing I guess I would highlight, and it seems at the very minimum, everyone wants to see some kind of act that is modeled, as Melissa said, after the Canada Health Act, at the very minimum, with the same principles, and there are those, the Nurses Union or Nurses Association of New Brunswick, for instance, they want to see long-term care within the Canada Health Act. And, that had been the recommendation at the time of the formation of the Canada Health Act. So, we know all of the things that would make a difference in terms of staffing, in terms of the quality of care. And then I guess one point that we want to highlight, because this is a moment to really reimagine the entire thing. This thing is just rotten to the core. It is just not working, right? It is fatally flawed in its current form. And so this is the time, after what we have all been through, to say, how can we do it not just better, but why can't we aim for the best system? Why can't we just say unapologetically, Canada is going to be the very best place if you need, to live in long-term care. It's going to be the very best place in the world for that. I don't know why we can't have that ambition for ourselves. But in addition to living in long-term care facilities, part of the reimagining has to be shifting policy toward community care, and getting some real investments in that. We invest less than half of what other OECD countries do, and helping people to age in place, to live in place, and also remembering that not everyone in long-term care is just a senior. So again, it's I will take, and if there's a new thing, I will fall off my chair, because Dr. Vivian, you more than anyone know this. There's such a consensus. And so this is why I say that, given there's that consensus, and given that we really should follow the evidence where it leads us in terms of what would work and what has worked in other jurisdictions, this is a no-brainer. This is something that I should be able to go to to Jagmeet and to Aaron and to the Prime Minister and to Yves Blanchette and say, look, this is something that we can do, all of us together right now. The debate is over, so let's move to action.
I agree. And it's funny you mentioned Aaron O'Toole, because we've mentioned this in other town halls. We have tried to invite them to partake in these town halls, but according to them, national standards is just red tape. That's how they see it. It's just added bureaucracy. So we're very aware that we're not going to get some sort of support from Aaron O'Toole. But we all know that we clearly have support from Jagmeet Singh. And I've had conversations, and I did address this directly with the Prime Minister, and he obviously seemed to acknowledge that national standards are needed, but there was definitely a sense of trepidation from him, in that you could see the jurisdiction issue was looming in his brain, and being aware that some provinces will present a more difficult time than others in playing ball, so to speak. But I think,
can I just say one thing about that again?
Yes, please.
Putting the the lawyer hat on for a second, but you don't need to be a lawyer, right? I mean, this thing about jurisdiction, first, I'll give the philosophical point, which is that jurisdiction and our federation was never meant to prevent us from being able to take care of each other. And if that's the point we've arrived at, then we've got a really big problem. And then the other thing that I would say is that, we are almost certain to see in the budget that we know is going to now be presented on April 19th, we're almost certain to see a bunch of money set aside for universal childcare, which I support, our party supports. We're very excited to see that, and we hope it's an ambitious plan. Now, education is provincial jurisdiction, and yet the government has absolutely committed to do this. And so I don't know why we're saying that we will take care of the youngest among us, and we won't take care of the oldest and the most special needs people amongst us. There is no logical consistency there, and I think that if we're going to do one, we have to do the other. And so yes, I completely reject this jurisdictional thing, and I think people in Canada reject it too.
Yeah, sorry, go ahead, Kathy.
Yeah, you know what, Annamie, I'm listening to what you're saying, and you hit on a point that you want Canada to be the best place in the world for long-term care. And yet the reality right now is we are so far from that. So far from that. So, oh, sorry, I muted you, Melissa, just because you're on screen there. So my question is, and I find this is such a strange anomaly, right? We love universal health care. We're so proud that it's the best. And yet, and we take care of our children, like you just finished saying, and yet somehow we overlook long-term care. And it's really horrible what's happened in this country. So I'm wondering, to me, as a family member, I lost my dad in long-term care. I kind of see it as the government's banking that we'll just keep looking the other way. Do you think that that's true? Do you think there's any validity to that statement, or why do we treat long-term care this way?
Yeah, I'll bounce it over to Mike and Jenica. I have been so inspired by people throughout this pandemic, and I do think that it's transformed us in some important ways. I think the way that we value life and the way that we answer the question, what is a life worth, is one of those things. I will say that I believe that the fact that there are so many women involved in this is part of the answer to your question. Women live longer than men. They make up a larger percentage of the people in long-term care. Women are the ones who are the personal support workers and the nurses overwhelmingly as well in these facilities. We've seen the feminized face of this pandemic. We've seen all the different ways that women have been disproportionately negatively impacted. And this is one of those things. I hope that, again, whether we are impacted personally or not, that this is one of those moments where people in Canada say, we will care for each other. And we demonstrated that during this pandemic. But I think, Kathy, that's part of it. I don't think it would ever have been allowed to get this bad if it hadn't been, in many respects, a women's issue. And maybe the last observation is that we really value the Canada Health Act and the things that are within it. The things that are outside of it somehow aren't considered to be healthcare, and that's a problem. And I think that's one of the reasons some advocates are pushing for it to be folded in, because it's dear to everyone's heart in Canada. It's one of those national treasures. And so if we treasure long-term care, perhaps it's time to think of having it in it. And I'll pass over to Mike and Jenica. I don't want to hog all of the, I'm on my high horse about this one, I'm sure.
Well, I have a question for Mike, which I'm sure he'll get to this, but before I ask Mike the question I was going to ask him, the issue of this being a woman's problem is something that we've discussed at this group. I think it's something that is coming more to the surface. And I'm so glad that you acknowledge that, and that the workers are primarily racialized women. Yep. That is part of the underlying foundation of what's going on here, that and our attitude towards our seniors. So Mike, you were talking earlier about the food program. It was astonishing to me to listen to you talk about that, because, there's been a ton of advocacy about food in schools. And it's shocking that you couldn't get farm to table quality food in our long-term care homes. You talked a lot already about where you think this government went wrong. Do you think that this government is going to take it? Do you think our government is going to accept a check from the feds that are tied to national standards?
So Melissa, I know we've had a lot of conversation today about working across party lines, nonpartisanship, and every day in the House, I go down there and I want to work with my NDP colleagues, my Liberal colleagues, and my Conservative colleagues as best I can. But in this one, sadly, I think when you think of some of the premiers who are going to resist this, Premier Ford is one of them. And it's one of the reasons I think it's going to be so important to have such strong advocacy in Ontario. I mean, this government has really shown an inability or a lack of political will to spend federal money to prevent the second wave of the pandemic. That's what I find so infuriating is like the government had $12 billion over the summer that they could have spent not only in long-term care, but in, in our schools to reduce class sizes, expanding our testing capacity and lab capacity, supporting small businesses that were shut down, providing paid sick leave to support essential workers. And they were reluctant to spend that money. And I keep thinking if you look at other jurisdictions around the world, those that more aggressively contain the virus perform better economically. So it's even against their own economic interests. They were unwilling to spend what was mostly federal money. So I just don't get this lack of political will to invest in people, to invest in our communities, to invest in caring for each other. And I want to go back a little bit to the previous question. I was wanting to jump in because Annamie was so bang on with her response about how, so much of long-term care is disproportionately women, both residents and workers. And the other one for me is the way we value work in our society. Like we don't value people enough as just people, as our fellow human beings. And, I think one of the challenges with long-term care via schools, for example, is, with schools, we're educating the workers of the future. And unfortunately, we don't view elders as making the same contribution to our society, which makes, I think, Jenica's statement about, having an Indigenous family is just how much Indigenous cultures value the wisdom and contributions of elders. And those of us who are settlers on this land, our cultures don't value, historically have not valued elders to the same extent. And I think some of it comes to how we value work and what kind of work we value. And so one of the things I'm hoping that as we come out of this pandemic is that we value the caring professions and we invest in the caring professions, whether it's long-term care, healthcare, childcare, mental health services. We just have to value people whose work it is to care for people more.
I could just add a couple things to that too. My province is also one where our premier is not willing to accept national standards and has very much pushed back against, even a lot of the federal funding options as well. So it's very much an uphill battle here as well. But you mentioned some of the, successes internationally, even around COVID. And I have to look to New Zealand for so many things because I just love Jacinda Ardern. But, they measure success on well-being. I think that's a major, culture shift we need to also see here in Canada that would reflect all of these things we're discussing is that, how do we measure our success? It should be on quality of life. And that should be from our children. We do need universal childcare as well, but right to end of life stages as well. So we're just kind of missing the mark on how we value, our lives and how we measure that success. So that's just something that kind of kept coming to mind for me. And I think, the reason as well that it hasn't been changed, and it's just reiterating, everything that's been said, that it's vulnerable voices in our communities. It's communities that have been discriminated against. So, it's for us, that's where we live, in the green world. These are the voices that we really love to amplify and to stand up for. So it's again, we do work as hard as we can across those partisan lines, but I'm proud to stand with colleagues, and have Annamie as my leader, and just especially on this issue, you've been so incredible. So just thank you a million times over.
Jenica, while I have you here talking, I have a question for you. So, from, I think, Quebec West, we sort of look at the East Coast, and what's happened in long-term care during this pandemic is something that we aspire to, right? And I was talking to a family member, not from New Brunswick, but from Nova Scotia, who was saying to me, the big thing for my dad and his home is we didn't have any COVID cases here, which is the big thing they want to tout. But when she told me the stories of what's happening in long-term care, it is identical to what's happening throughout the rest of the country in Ontario and Quebec. So do you think that we've sort of boosted the East Coast long-term care as just surrounding by COVID? And what kind of dangers does that bring to not fixing long-term care?
Yeah, I think it's important that we kind of bust the myth that, we did things in a much better way here. I think that we were lucky for a number of reasons, but, smaller population, we have a very rural population. We kind of shut down the border, so we had low COVID case numbers. But if that didn't happen, we would see the same high number of deaths, because we're making the same mistakes here that we're seeing all across the country. New Brunswick mandates, I think, is 2.4 hours of care. Our union's pushing for 4+, but in most cases, we're not even reaching that 2.4 hours. That just boggles my mind. And I think, Mike, you said the word unforgivable a few times, and that's really just how it feels. So I think that's, it's nice to have people talking about the East Coast, because we're often forgotten about, past that Quebec line, but it shouldn't be, because we should be this kind of standard to measure ourselves against. If anything, as I said, we're moving towards a model that's less people-centered, that's more about privatization and for fee for service. So I'm very concerned with the direction that we're heading, and it's just kind of been happening under this, the quiet, COVID numbers that we've been seeing, but it's very much still an issue here. And so it's a bit of a myth, I think. So we need to talk honestly and openly about that. And, even as recently as last week, I think our health minister just mentioned that it wasn't a problem around staffing, that it isn't a problem that we have, workers who have to travel to multiple homes. And that wasn't reasons for outbreaks or deaths, but we know that it was. So we have to be honest and open about what our mistakes were in order to fix them and to move forward. So there's a bit of a problem that it's looming just around the information that's available. So, and I know families are feeling frustrated by that, and they're eager to speak out. So hoping that this is the opportunity for that to happen.
Yeah, and I just want to add to that, one of the things it's people are talking about it a bit more, because we're now starting to feel the reverberating impacts of the pandemic, in all areas of life, but including in long-term care. We don't yet know all of the casualties. We know how many long-term care residents died from COVID. We don't know how many of them died from malnutrition and dehydration and isolation and poor wound care for bed sores and infection because they haven't been showered properly and on time, and dental care. I mean, these very basic necessities of life. Imagine not being able to brush your teeth twice a day or once a day. Imagine staring at your glass of water sitting on your nightstand because there's no one to give it to you. Day after day after day, we don't yet know those casualties. And those casualties only exist because of the issues that preceded the pandemic, right? And we talk about this a lot, but I think we've been talking about it so much from the perspective of infection control. That I think, it's when you say, 2.4 hours a day, we don't even have a standard in Ontario. And for those listening, when we're talking about these numbers, we're talking about the hours of care provided by a staff member to a resident in a home. So when Annamie and Mike are talking about, 4 hours is sort of unanimously accepted as the bare minimum, that's 4 hours out of 24. That's it. That the resident should at least be receiving some one-on-one care from a staff member, and they're not even getting that. And for you to say that, Jenica, that it's 2.4 hours, and like some of our provinces have no legislated standard. Now we're hearing experts talk about 6 hours per day. And I'm curious, we'll open it up now. I only want to talk about this because each of you have mentioned it. And this is where we get into that sort of jurisdiction fight. How do you think the federal government can talk about these national standards from the perspective of a staffing ratio without crossing the line of jurisdiction when that's something that the provinces need to take care of? Because this is the difficult fight. And I mean, I have my views on that, but I'm curious to see what you guys think. Maybe we'll start with you, Annamie.
Again, I guess, I don't know, I don't struggle with these things as much. Part of it, I would say, is because we are talking about life and death. And you're just completely bang on with the point about the additional deaths, because my father did not die of COVID. He died, and the stories that I've heard most often are the people dying because of that perfect storm. The existing understaffing, lack of training, and then you add on top of it a pandemic and all of the circumstances that come with that. It was just too much, right? The system was just overwhelmed. And so people died, as you said, lots of people, malnutrition, just a simple lack of care, infections. My father's case, it was an infection, completely treatable. I mean, nothing like antibiotics, a few days of antibiotics. That one's very common, right? A little infection that goes untreated and then turns into something catastrophic. And so we are going to be reckoning with this for a long time, and the count that is just the tip of the iceberg. I think many more people died through those other circumstances and continue to. And so, when we look at the Canada Health Act as a model, it creates just a baseline standard. Of course, you need to be able to modify, right? You need to be able to reflect local realities, regional realities. You want things that are as bespoke as possible for the population that you're dealing with. But there is just a baseline, and that's where this consensus comes from, right? The advocates, all of you have said this is the bare minimum, and of course, I don't think that that's good enough, but at least you say that here is the baseline, that wherever you live in the country, whatever your circumstances, we will never allow your care to fall below this level. And if a province wants to top it up, if they want to, if one province may approach it one way and another the other way, the destination has to be the same. And so again, we have examples in this country, as we've talked about, of programs designed that way that we are very proud of and we would never want to do without. This is no different. And I would again throw back, and I think I'm going to be doing that a lot in the days to come, the universal childcare example, which is, how are those questions being answered? Because the government has said very clearly that nothing is going to stand in their way of making a universal childcare a reality across Canada. These are all the kind of questions that we're going to have to answer as well. And we better come up with the right answer, because I just believe, as I said, people in Canada, they're out of the politicians who rely on jurisdiction are, for the most part, and particularly on this issue, very out of step with the people that they represent. We are all going to, if we're lucky enough, in a way, end up needing support at some point in our lives. And many of us have loved ones. If it's not us, we have loved ones that have been in contact with the system. This is so up close and personal that, I believe this is one, as I said, with the political will, you can build the consensus the same way they did for the Canada Health Act. That was a cross-party, unanimously adopted piece of legislation, right?
Yeah, let me ask, and we can all open our mics now. We're all in a gallery view with open discussion. So what do you think, and I'll put it to anyone who wants to answer, really, talk about folding this into the Canada Health Act, and yet there are people who say that could be a dangerous thing to do because everyone can have their hand in the pot. So what do you think about creating a piece of legislation federally specific to long-term care as opposed to folding it into the Canada Health Act, but modeled on the Canada Health Act?
Well, we've said, if Paul in his motion put that forward today, and that's something that, we try as much as possible to be guided again by all of you on these things. We really take a lot of time to think about those things. So, I mean, there are pros and cons to both. We're comfortable with both. What Paul proposed today in his motion was a long-term care act modeled on the principles. So yes. And if that sounds like sitting on the fence, that's okay, because, I really think that people will take either. Both of them, neither system will ever be perfect. What we're looking to move toward is something that is demonstrably, definitively better than what we have now. And both of those options are better. As I said, the main thing with the Canada Health Act is that, we were warned by the Canadian Medical Association back in the 80s, at the time of the introduction of the Health Act, that if long-term care was not included, that it was going to become a kind of an orphan. It was going to become a second-class citizen. We've seen the same thing with mental health care as well. The things that are in it are healthcare. The things that are out of it are not. And so they get to be commodified, et cetera. So that's one thing, but it's not a perfect system. So maybe again, let's aim for what's the very best that we can do. And if it is to have an act that's modeled on the principles, but that is its own thing, that's certainly, I'll speak for myself. I haven't checked with the entire caucus, but it's something that I could certainly live with.
Yeah, I'd agree with what Annamie has said. And I have met with a number, and again, let's be guided by the experts and also the people with lived experience as well. And some people have expressed a concern that one of the difference between long-term care and healthcare is that long-term care is somebody's home. And while we want to make sure people have proper standards of care, adequate standards of care, adequate healthcare, you don't want to completely medicalize the experience either, because it's a person's home. And so, again, I could go either way, but I think that is one consideration of looking at its own separate set of standards and separate act modeled after the Canada Health Act. That would be an important consideration.
I just would add that, Canadians are looking for really bold actions right now. We're living through a pandemic. We don't want the same old status quo. So something needs to be done. And to see that kind of concerted effort, including provinces and territories and the federal government, opening up this conversation in that real honest way I was talking about, studying it, bringing in experts, bringing in witness testimony. This is what we need to do. So whatever it takes to get us there, whether it's a new piece of legislation, I'm certainly on board to do that. And Paul's a great example. Paul Manley, can't say enough good things about my colleague from Nanaimo, Ladysmith, and he was sounding this alarm before the pandemic as well. So it's just important to know that this is an issue that's always been important for us, but just that people realize now how critical it is. And when we think about the lessons we've learned from COVID, this is one of the top three, that people are really looking to have answers on. So this is the time. So we do need that, transformative action now, and it's got to be bold. It can't just be, slight updates here and there, conversations from individual premiers. This needs to be a concerted effort.
Could I add one comment just in response to Melissa's earlier question? I think if the federal government puts enough money on the table, if the provinces say no to that, then I'll say, as a citizen of Ontario, I am sure my colleagues in the other opposition parties, we will be hammering the government all day long at Queen's Park, and I'm sure in other provinces. Like, you're going to say no to money to support the people we love in our province? Like, come on. So, I would say the best way to overcome a lot of the jurisdictional issues, to me, that's an excuse for inaction. And I think that's really what Annamie's been saying, is we have to get past this excuse to not act, and using jurisdiction as an excuse not to act is just not acceptable.
Vivian will be leading that charge.
Yes, Vivian is leading that charge.
Yeah. Well, I'll be honest with you. My concern now, and I spoke to this to the commissioners, is that when I testified, is that because we saw what happened in long-term care, and a lot of people don't want to go to long-term care, now a narrative is starting about home care. And I'm all for aging in place, But my concern is right now, particularly in Ontario, we are seeing home care is an even further privatized mess than long-term care is. And imagine taking the problems you've seen in long-term care and then hiding them in, a million different private households. And that's exactly what it would be. And there's even a bill underway right now to further privatize it, that the Ontario Health Coalition has been very critical about. Bill 175, I believe.
Yep,
so
that's right, yep.
My concern is that in order to avoid implementing the kinds of changes that we need in institutional care, because whether we like it or not, there's always going to be a subset of the population that needs institutional care, especially now, given that, women are working before and this is another thing. The Canada Health Act was created at a time where we had stay-at-home wives and mothers. And they did all this very difficult, backbreaking labor, unpaid, hidden in the households. And what we're seeing now is this further privatization is seeking to cut costs in one area by offloading it into private households. And that is my concern, that that's what's going to happen in governments, particularly progressive conservative governments that, just seek cost cutting. While denying the evidence that privatizing this care further just spells disaster across the board. So that is my fear, that if we just focus on now home care and not actually address the same issues that plague home care in long-term care, we're just going to have an even greater problem 5, 10, 15 years down the road.
And that's the issue exactly. And that's why we're talking about comprehensive, holistic solutions. It's like so many things during this pandemic. You plug one hole and there's another one that springs up somewhere else, or maybe plugging that hole creates an unintended consequence somewhere else. We need to look at the whole thing. And you're absolutely right. There are people, we have to make it gold standard, because exactly, there will always be people who need long-term care, who need to live in an assisted living environment, in a facility. But there are those who are there because there aren't other options. And there's also cultural elements to this as well. I mean, our father went into long-term care after we had exhausted every possible other option, and he couldn't get up the stairs, and they were on a second floor, because in some cultures, you just never, ever, ever put your family in long-term care. It doesn't matter if you're sending them to the Ritz-Carlton, it's just not done. And so, we need, but if you're absolutely right, if we do one thing and we don't do the other, then you're absolutely right. There is that risk that the system can be gamed, that it can be offloaded, and that, as you said, it becomes even more invisible. And I would add that, Kathy, to the list of things, right? When you ask why is this being allowed to happen, and why has there been so much inaction? Part of it is the invisibility of it. Everyone, until all of you came along, there were all of these personal stories. I mean, those existed well before the pandemic, of the neglect of their parent or loved one or whatnot in long-term care. But this has exposed it. A lot of it was invisible before, and you've helped to expose it. The pandemic has exposed it. And that has, hopefully made it harder to ignore. But I agree with you, Dr. Vivian, and it really is about taking this moment to first triage, right? Deal with the urgent things that are keep causing people to die now, and then talk about a full plan that talks about how we're going to respect people at this stage of life, the people who are in need of these particular services. Absolutely.
I wanted to add another fear that I have, and something that would come with national standards, is the idea of a database. We don't even have an accurate picture of what's really going on. New Brunswick doesn't record any records. Any of the things we've seen out of that New Brunswick Nurses Union report was anecdotal surveys. There's no records of, say, complaints that are made, or compliance issues. So that's a major problem. And we need to have an idea of what we're actually dealing with. We don't even really know just how bad it is just yet. So that's a huge component of a national plan, would be collecting data.
Yeah, I mean, certainly I can tell you again, I'm going to refer back to this legal opinion that we got. The idea is really centered around accountability and transparency, right? You're not just going to get a blank check for federal funds. You've got to comply with the standards, and part of those standards include an accounting for how we're going, or how the money has been spent, where it's going to, and making sure that the provinces have mechanisms in place for accountability at the provincial level. So I think, I loved your metaphor, Annamie, about what the urgency of all of this. And it made me think of like a life raft. The national standards are kind of like the life raft that we need like immediately to take us to the safety of the island where we can sort of rebuild, because there we need to rebuild badly. And I think I can safely speak on behalf of Kathy and Dr. Vivian that we're not ending our advocacy with national standards. I mean, this is just the start, because now people are listening. We are at time. I want to thank each of you so much for coming and sharing, hearing your advocacy on these issues is wonderful because it mirrors ours. I think most of us were just going like this, like the entire time that all three of you were talking. So thank you so much again for coming on and talking about this and all of your advocacy that you're doing in support of national standards. It's been wonderful, and we look forward to working with you guys going forward.
Thank you so much, guys.
Thank you all.
Thank
Thank
you.
you.
Appreciate it.
And
Keep up the good work.
don't stop being such amazing advocates.
Never.
Like, you do
Never,
not
never.
stop. You're doing amazing work.
Just to say, there's a provincial election coming up in the not too distant future. I'm sure for those of you who are here in
22.
Ontario, Mike's recruiting, and if that doesn't tempt you, we've got I think a federal election happening in the not too distant future. And all joking aside, this is the kind of leadership we need in our legislatures and in our parliament. I mean, this is exactly the kind of leadership we need at this critical moment. Just putting it out there.
I think we haven't thought about it.
I can't wait to hear
I
you ask a
asked.
question. So I want to hear your questions in question period. So
Exactly.
Okay.
Oh, I wish I could be in there.
Thank you so much.
Thanks, everyone. Thank you.